Hello.
Hello. Okay, we are back with our friend and favorite, Bethany Powers.
Hi.
Hello again. Thanks for coming back. Okay, what are we talking about today?
Well, what do you want to talk about today? Well, I want to talk about
what's happening with my face.
Your beautiful face.
Oh my gosh, just in time. Halloween was yesterday, and I somehow magically timed this chemical peel to perfectly align with Halloween because my face is melting off.
Yes, it's spooky.
It is. My 7-year-old was like, "What's happening to your face? What's going on?" And she's like, "Mom, that's scary. That's gross."
Yeah. But you have some nice color coming up.
I know. See
There's
all
a nice
this?
peel coming.
I mean, okay, so am I crazy? Is this just like dry, dead skin and that's why it's going brown? Or is that pigment that's like being pulled up?
I think some of it's pigment that's coming up. I think it's a little bit dry, like dry, dead skin.
It's
but
definitely...
I think that, like, especially around here, you have like almost a little bit of some, what we call like coffee grounds.
Yeah.
Like, they come to the surface. So, yeah.
Okay.
Yeah.
Because I was wanting to make sure that I wasn't just spreading false information that pigment was being like pulled from my skin.
I think so.
Okay. Because like that's what I thought was happening, but I just wanted to hear it from
You'll get some, with, you were telling me you did a 15% TCA peel.
Correct.
If you do, the deeper layers, if there's pigment in the deeper layers, you may not get that pigment coming up, but some of the surface stuff for sure will start to flake off.
Awesome.
Yeah.
Because, I mean, not to get like, we can totally go into chemical peels and whatnot in a different episode, but like, not to get too nerdy, but the melanocyte, of course, is down in the dermis, and it's sending that pigment up through the layers of the skin. And so what the TCA is doing is getting that pigment up here on the uppermost layers. Yeah. And that's what we're seeing sloughing off here.
Because the only peel that was out there on the market, a lot of people don't do them anymore, was a phenol peel.
Oh,
that gets deep. And that's the one that, like, you have to be on a cardiac monitor for, and it can cause arrhythmias, and you're only supposed to do like a portion of the face. We're talking about, like, most people don't do these anymore. We talk about them. They're always tested on boards for some reason because they're kind of like the root of why we started doing this, resurfacing.
Yeah.
And so the phenol, like, you could only do 1/8 of the face to begin with, and then you have to move on to another section because if you do too much at once, even if it's full face neck,
it's like way too much for the body.
Like cardiac toxicity can happen.
Oh man. Okay.
So that's like a deep peel. That's the definition of a deep peel.
I definitely want to learn about that.
Yeah.
So what like an esthetician can do for you is like a light to just under a medium peel.
Yeah.
Awesome.
Yeah. And the TCA, like you have a 10, right? A 15. There's also a 20. I think there's up to like a 30 out on the market. Personally, I've only ever used a 20 because that's kind of what we have in the practice that I trained in.
Okay.
But the way you can get it to penetrate deeper is if you do cold. So if you apply cold to the, if you're talking about like a brown pigment spot, if you're trying to get that to get into a deeper aspect, if you get a little bit of cold on it, like liquid nitrogen, like a Q-tip dipped in liquid nitrogen, you can get it to penetrate even deeper, interestingly.
Yeah, so y'all aren't getting liquid nitrogen on your face. I certainly am not, even as an esthetician.
No.
That's like doctor level. Because estheticians, I don't know, it differs state by state, which makes it really kind of hard.
Yeah.
But in Utah, I have my master aesthetics license. So even as a master esthetician on my own, 15% is the highest I can go with a TCA. I can go up to a 30% under a doctor. Like if I were to be working with you under your license and you're supervising me, I'm allowed to do it up to 30.
Yeah.
But yeah.
Yeah, kind of like that.
That sounds intense.
Yeah. And I've largely moved away from chemical peels, and I mainly use laser.
Yes.
And like we were talking about, like if you're really trying to resurface somebody, say they have like those deep rooteds that are like the smoker's lines, or, in Utah from sucking on a straw from drinking too much swig, that kind of line.
Absolutely. We love our sodas here.
Then you really need to get a deep peel.
Absolutely.
And if you're doing that, again, like phenol, it's a great peel if you know what you're doing, but like if you don't, it's really finicky. So really the best thing to do is actually a controlled laser.
Did they switch from phenol being more widely used to maybe the CO2. Okay,
Yeah.
that's kind of
CO2, or the other one is an erbium YAG.
Oh.
And an erbium YAG penetrates a little bit in a different way. They've done like head-to-head comparisons.
Okay.
CO2 came out kind of. I'm sure there's some laser expert out there that's going to correct me, but in my understanding, CO2 has been out the longest, and that was the gold standard. The erbium YAG came out later, and then they kind of did a head-to-head, and they looked like, okay, what's better? And they think that there's more thermal tightening in the CO2 laser than there is in the erbium YAG, and so you think like, okay, maybe you'll get more tightening. I don't know that it's clinically any different.
Okay.
So it just kind of depends on what you have.
Maybe the difference to the untrained eye, or even not under the microscope, isn't enough to be like,
like, oh, I need a CO2 or I need an erbium YAG. It's like, you need resurfacing, and you need to do
bottom
it
line.
Somebody that needs to knows how to do it. So, yeah.
But I love that in your training, you have been able to focus on lasers so much. That's kind of unique in the plastic surgeon space.
Yeah, it definitely is. I went to a very comprehensive facial plastics fellowship through the American Academy of Facial Plastics, and I went to UC Irvine, and UC Irvine has the Beckman Laser Institute.
Oh, very cool.
And so it's nice, and then it's a collaborative effort. The person that I trained under, he does a lot of research. He's actually within Beckman. And then we had a person that's in the dermatology department who was doing like port wine stain treatment. So, I mean, you name the laser, they had it. It was very nice. Lots and lots of money at that place to be able to offer like high-end laser therapy for patients. But it was nice training.
Okay, I really feel like you need to set up a field trip for me.
It's really cool. It's really cool.
I would love to go check it out.
Yeah.
Oh my gosh. Yeah. Okay.
Well, we went on topic on
I know.
lasers.
Okay, so that'll be a podcast for a future date. Bethany and Bree go on a road trip.
We go to the Beckman Laser Institute.
Invite us, please, Beckman. Okay, but for today, what we're talking about and the transition from chemical peel to this is really anti-aging. So much time is spent on anti-aging our face, and we kind of stop along this jawline. But like, this gives us away so much of the time. And last time you were on, you and Teresa talked about the hands and how much those age us. But what about the neck area?
People forget about their neck.
Absolutely.
Just as bad. Where I'm like, okay, I'm gonna put my makeup on. Okay, I'm gonna start up here. I'm gonna get my sunscreen on, right, my base. And then it's like whatever I have left on my hands, I'm smearing on my neck. But like, really, you do need to do another whole pump. Like one pump for here, one pump for here, and then if you can do back of hands too, that's really where you're gonna get the most sun exposure.
Absolutely.
People also forget about their chest, especially if you're driving. Think about if you're driving and you're in the car. You might be able to block the sun in this area from your eyes, but really your neck and that chest is getting that direct sun.
You're getting hit hard.
Yeah. So I know we were talking about, we're in our 30s.
Yes.
Bless our hearts.
Almost the 40s.
And it's like a lot of patients come in and they're not necessarily talking about going into having like a full neck lift facelift at this age. They're really looking at those preventative steps.
Absolutely.
Or almost like, the term that gets thrown about is like, how do I make my jawline snatched? This is the top. I don't know where this term actually originated from, but
etymology is insane.
Yeah.
That's a whole other podcast. But yes, snatched. Like, snatch me.
Yeah, like, oh, make me snatch. Ooh, hashtag snatched. Are the kids even hashtagging me?
I know, right? I always think about like that SNL Saturday Night Live episode with Jimmy Fallon and Justin Timberlake, where it's like hashtag.
Yeah.
Everything's like they're talking in hashtags, and everything's like hashtag.
They would say, no, that's obsolete.
You're not cool anymore.
That's how you know
Mom.
you might need to think about your neck, I guess.
I know. Like those memes, like if you wore jelly shoes, it's time for retinol.
Yeah, exactly. So same things where the two biggest products that you can do for both prevention of wrinkles as well as kind of your maintenance for products are going to be a sunscreen.
Yes.
Every day, like we talked about, all day, every day, anywhere you're going to go, indoors or outdoors.
Multiple times a day.
Multiple times a day,
Not
especially
just morning.
If you're outside.
Yeah.
If you're like working in an office, I still recommend doing at least morning under your makeup, or and doing like a talc type of powder
Okay.
that has zinc or titanium dioxide mineral based powder within that too, because then you can reapply and you're not getting greasy again or smearing your makeup.
Yeah, I think that's the main reason I don't reapply.
Yeah.
Naughty esthetician is I just feel like I'm like getting so gunky throughout the day.
Like, ugh. Then it's like, why
I
don't I
don't
even do my makeup? Yeah.
And that's another question I've heard is like, why am I putting on sunscreen underneath my makeup? Shouldn't it go on top of my makeup? And it's like
technically yes, like the sunscreen should be the closest thing to the sun.
Okay.
If you can do it.
Right.
So, if you think about like your order of putting them on, you wash your face, you put some sort of active ingredient on, whether or not you're on like a clindamycin lotion that's prescribed for you or benzoyl peroxide type of thing that's prescribed for you. Whatever you have that's prescription should go on next. Technically, benzoyl peroxide shouldn't be mixed with your retinol. Just that FYI at night, they don't work.
She's
together.
so good at giving us these little secrets. I love it.
But if you're talking about daytime,
okay,
then moisturizer. You want to put your active ingredient on, and then sunscreen should technically be the closest to the sun.
Okay,
which is great. And if you can really bonus it, and you're going to do a mineral-based kind of makeup. That also is going to give you some sun protection.
Just giving you a nice little dusting.
Yeah.
Love that.
Yeah.
Okay. So for anti-aging, what are people looking for to do in the neck?
Yes. So we are starting to see some changes in the neck. Some people are starting to see more skin laxity or like necklace lines and things like that.
Okay.
So there's some options out there, starting from kind of most conservative with the topicals, right?
Right.
So sunscreen and a retinol at night. So sunscreen during the day, retinol at night.
Okay.
Always.
And I love that because like a skincare line I love, Image Skincare, their theme that they go along with is daytime is for protection, nighttime is for correction.
Yes. Yeah. Very much so.
Absolutely.
And if you do it every day consistently, when I see people that are 65, 70 years old and they're coming in for a neck lift, you can really tell who has used a retinol for like 35 plus years because they have thicker skin.
Oh,
and think about those older patients that we all, not necessarily patients even, just people you see in general, and you're like, you look translucent, right?
Yeah.
And part of it's just genetics.
I can see through you.
Yeah, we can't do anything about that. I'm not trying to shame anybody for having that type of skin, but I'm telling you, if you use a retinol, you're going to get yourself thicker skin long term. You're going to maintain that collagen long term. So that's kind of on the conservative end. Medium kind of end is something like an injectable, such as like a neurotoxin, right? We all know the household name Botox, Dysport, Xeomin, Daxxify, you name it. There's a bunch of different ones, Struvo, right? There's all sorts.
Yeah.
But kind of getting yourself on a maintenance plan in that way. Don't wait for your wrinkles to set in before you correct them. You're trying to like prevent them from setting in.
Absolutely. One surgeon I spoke with, he described it this way, like if you're folding a piece of paper, the more you're folding that paper, the harder it's going to be to smooth that paper out. Are you
going to iron it out later? Like, it's harder.
Yeah. And that's kind of what your face is doing. Like the more you're moving it, it's like folding that piece of paper.
Right.
And what the neurotoxin is doing is just making it so you can't fold that piece of paper.
Yeah. And if you're talking about the neck specifically, you can treat with a neurotoxin. You can treat your muscle. I call it the Hulk muscle. I'm going to show everybody.
Okay, let's hear it. Ooh.
It's a great muscle. But it's this muscle that kind of comes up and attaches to your jawline. It goes down your neck and then it attaches down here further.
Is that the platysma?
Yep. So the platysma, it's like a sheet. And there's two. There's one on each side. So it's not connected in the middle. And as we age, sometimes it's, again, genetics, that muscle parts. And that's when you start to see people say, oh, I have a turkey neck.
Oh.
And it's not extra skin all the time. Part of it's extra skin, and a lot of it's the muscle.
Okay.
The platysma, like you're saying. Yeah.
I love it.
So you can do some preventative things where you can Botox or neurotoxin, treat that area if you're starting to get a band. You're seeing that kind of in this area.
Is it like, so you're seeing like that double band go down, and it's that space in between that you're trying to prevent by, quote unquote, freezing
your muscle.
These muscles.
Yeah.
Okay.
And it doesn't change, everybody says, oh my gosh, don't you need those muscles to like move your face and move your neck?
You have other muscles.
Yeah, it's really, it's an accessory muscle. It's
Okay.
not the main muscle that moves your neck. That's
Mhm.
it's a different one. That's one here that's called the sternocleidomastoid. So
Uh-huh.
I don't recommend Botoxing
Don't do that one.
any of the other muscles around that area. But this is one that's very close to the surface, and that's the one that people start to see.
Okay.
So again, if you're like 30s, 40s, even into your 50s, you're saying, okay, well, what can I do to kind of prevent that muscle from just like looking more prominent over time?
Mhm.
A little bit of a neurotoxin can be conservative.
So the most you're not going to be able to do is this. I mean,
Yeah,
how
and
much?
still you will. You'll be able to do some. It's just you're not going to see as much of it.
I mean,
band.
do we really want to walk around like this?
Yeah, the Hulk it out. Yeah.
We're good.
Yeah,
Okay.
Yeah.
So what is then that third
yeah,
option?
yeah. So we're talking about the third option,
Mm-hmm.
and this is an option where a lot of people, I know you and I were chatting about this earlier, like people think that if you're thinking about a neck lift or a surgical intervention, that you need to correct. And that's not necessarily true. We all know those types of friends of ours that they might be a very thin person, but they
Mhm.
still have maybe an undersized chin, or maybe they have a little bit of a fat pad here, even though they're thin. Right?
Yeah.
Even though like they might look like they almost have a double chin, even though they're
Mm-hmm.
thin. So there are options for those patients out there where you can actually contour that. And it's not the skin. We're not talking about just extra skin. We're talking about the muscle,
Mm-hmm.
the platysma, and then the fat pad that lives under the muscle.
Okay.
And so if you get in there and you basically are lifting up that floor and you're tightening that muscle, you're making like a little neck girdle,
Like
that
a little.
really helps.
I like that.
Yeah.
A little
Yeah.
neck girdle.
Just kind of
Little corset.
snatches it up. So that's where you can really improve that contour from the side. If you're looking at a profile view
Mm-hmm.
and you're like, okay, from the side profile, if you feel like this is blunted, you can get some contour improvement.
Okay.
Yeah.
I love that. So you don't have to wait until you're in your 50s or 60s
No.
to feel comfortable coming to a facial plastic surgeon and
Yeah.
saying, I feel like I need a neck lift or even a facelift. It's utilized for
Mhm.
more purposes than just anti-aging
Yeah.
or, taking those years off the face.
Mhm.
Part of the conversation we were having earlier before we started recording was, for me specifically, like, I'm going to be 40 next year. I still feel too young to feel like I need a
Mhm.
facelift,
Mhm.
but, I'm someone who has lost 100 pounds
Mhm.
and it comes down to a confidence thing. Like, I feel like when you look at me straight on, I feel like I'm okay right here. Like,
Mhm.
I feel like I've got that snatched the jawline that I wanted.
Yeah.
But then when I turn in pictures,
Mhm.
I feel like I'm still that, 300-pound woman
Mhm.
that just
Mhm.
has all this right there.
Extra, yeah.
Extra.
Yeah.
And it's not like I'm seeing myself. I just see myself in pictures, and it
Mhm.
just kind of kills my confidence a little
You're
bit.
like, dang it, I thought
Like-
that was looking
I'm
good.
like, come on.
And it just
Uh.
depends on your genetics, like
Yeah.
everybody, we all have a fat pad here.
Mm-hmm.
And then the other thing that contributes is where your airway is positioned.
Okay.
So your voice box is in this area.
How can you tell where that is?
If you feel on somebody and I'm feeling for something called the hyoid bone.
Uh-huh.
This is a creepy
Oh, that's
segment.
that's crime podcast. Okay.
Yeah. So that's, on Crime Podcast, back to Halloween.
Ooh,
On Crime Podcast,
that's how you know where
know,
someone's been
yeah.
strangled.
yeah. So we're feeling that. If you feel your hyoid bone,
Uh-huh.
that's essentially your limit of dissection that you could get as a surgeon
Okay.
in that particular region if you're just doing a central neck.
Gotcha.
If somebody has a hyoid bone that's lower,
Uh-huh.
again, just genetics, that's where things sit. It's just like that's how you're built.
Okay.
Like when you're doing central neck work, you can't necessarily reposition that. There are some surgeons that can do it, but
Mm-hmm.
majority of the surgeons that are out there would recommend doing something in the central neck and then also approaching it from what we call the lateral neck or the outside portion of the neck. And that allows you to actually get that sling of muscle, the platysma,
Uh-huh.
as another like sling, like a corset. So you're corseting it a little bit here, and then you're actually pulling it from the sides and
Okay.
hiking that up.
So is that what you refer to as the deep plane
Mhm.
vertical neck lift?
Yeah, when you're talking
You're
about the
getting
deep plane, what does that mean? That means that you're doing your dissection under the platysma muscle.
Okay.
And then depending on the surgeon you're going to, some people cut into the platysma muscle and change the vector of how it's going, like change where it's going. So instead of it going up and down like this, you make a little cut here and you can actually tuck it back almost behind your ear. And that's how you can really get like that definition of your jaw. Yeah.
Ooh. Now, can you combine that with other things like buccal fat or what else?
All the other things that can.
I mean, I guess the options are limitless.
Yeah.
But for someone who is going for maybe, that post weight loss that still feels like they have a baby face, like what would you typically recommend?
It depends on the patient. Obviously, we always talk about like, okay, everything's going to be customized to whatever they want to, kind of address. But if you're looking at somebody from the 3/4 view, this view, and you see that they have fullness here, like the cheek is high, the cheekbone looks good, but they also have a really round area here, that's your buccal fat. Your buccal fat's not a jowl, it's not here. Your buccal fat is what we do when you're trying to suck it in.
So like, sorry, my hands are cold. Cold hands.
So you can take some of that down. And if you think about it, if this is really round, and this is round, and you're looking to get more contour of the jawline, if you take away here, so you're taking volume here, and then you're taking volume here, you're going to get a more prominent jawline.
Oh,
so again, it just depends on the patient.
I love that.
Some people would say, okay, beware of taking your buccal fat.
Yeah.
Right, like
because you're going to want that volume later in life.
Yeah, and I saw somebody, I can't remember, I think she's like 72. I saw her yesterday. And she is very small.
Okay.
She's kind of a frail type of person in terms of like her overall body skeleton.
Right.
And she's really missing that buccal fat. And she never had it removed, but I guarantee you,
over time she's lost it.
Yeah, over time it atrophies.
Mm-hmm.
Yeah. So you have to be conservative, you have to kind of balance that risk, knowing that when you're 65 or 70, you might want that fat.
It's true. So it's just kind of a decision you have to make with where you are at personally and what you're going to be okay with later on in life, which is kind of hard to predict.
Yeah.
Exactly.
Yeah.
So it's just kind of like having to, tell your future self, okay, we made this decision. We have to be okay with it.
And again, it's not for everybody.
Yeah.
I just think that, the way that I like to tell patients, I'm like, I'm never going to convince you to have a surgery. Like, I want you to have all the information that I can possibly provide for you to kind of make that informed decision yourself.
Which is what makes you an amazing surgeon.
That's nice. That's very sweet of you.
And it's very honest.
Thank you. Thank you. And I think that's something that if you are going to a surgeon and you're talking, I'm talking in general in the US, but if you're going to a surgeon, like, you need to ask them, like, what are the risks of this type of surgery? What could happen down the line? Not necessarily risks that can be disastrous or astronomical, but also like the risk of, again, looking gaunt when you're 65 or 70.
Yeah. Or maybe even, not that you can predict what procedures or treatments are going to be available even 30 years down the line, but what's available potentially, or even now that you could do, now we know you may not want to look gaunt, but if that happens, there are options to adjust that. You just have to be aware that's an adjustment you may have to make in the future. Yeah. And
just having
that
gotta
be okay with it.
Yeah.
And just being okay and open to having that conversation with your surgeon.
And them telling you the truth.
Exactly.
what information we have, right?
Exactly.
It's all kind of an informed decision. So.
Definitely.
Yeah.
And like you said, you can't predict the future. I don't know what I'm going to look like 30 years from now.
Right.
Heck, I don't know what I'm going to look like tomorrow.
Will I wake up puffy? I don't know.
Exactly.
Maybe I had some sushi the night before. I'm not sure, but
a little extra soy sauce.
Yeah.
Right?
Yeah.
So and that's where doing your research and finding a qualified, experienced surgeon is so vital.
Yeah.
So how does someone do that? Especially in the age of social media, I feel like it is so easy to find a multitude of surgeons who maybe aren't qualified to be having, who maybe will have that conversation with you, but in the end aren't qualified to be doing those procedures.
This is hard. It's hard.
That is a hard
It's hard
conversation.
to navigate out there if you don't have the expertise in it. It's hard to navigate and be able to be like, oh, that person has a lot of experience, or that person doesn't, or they had good training or not, right? The other day, I heard this interesting story from actually a person that I had interviewed with for fellowship at a different program, and he was saying that he had one of his people that was in training with him come in. So they were in a clinic visit together, and this patient came in, and the patient said to the more senior surgeon who had been there for like, I think he's been in practice 18 years or something.
Oh, wow.
Said something like, oh, no, I'm here for the other person because I saw his Instagram.
Oh, no.
And it's true, you know, that younger surgeon did have a more prominent Instagram, but he was still in training.
Oh, no, geez.
And so sometimes I think that there's, not necessarily for better or worse, it's not misinformation, you know, that person is a physician.
Yeah, it's just perception.
It's perception, yeah. And so I think, you know, yes, sure, look at people's Instagrams. I have an Instagram, like we kind of all have one.
Right.
But then like in person, you really need to be confident in who you're talking to and making sure that like the procedure that they're doing is something they do on a regular basis. So there are other ways you can look up. I'm pretty biased. I trained, you know, I'm only facial plastic surgery. So I don't do anything on the body. But that being said, there's the American Academy of Facial Plastic Surgery. We all belong to that if you're within the academy. And there's a Find a Surgeon on there.
Okay.
It's an underutilized link, I'd say,
Correct.
in comparison to everybody just getting on Instagram. But you'll be able to see, are they board certified? You know, do they have some of the credentialing that you need to back it up? Or are they, you know, just have a bunch of followers that they've paid for online, which is also, you know,
that's also
beware. Just do your homework.
Definitely.
Thing.
Okay.
Yeah.
Now, I know a lot of people turn to places like Real Self. How does that compare as far as like a search engine for finding a qualified surgeon?
Real Self is a paid subscription. So to be listed as a surgeon on there, we have to pay.
Okay.
It's the same thing with like a lot of the other things, like America's Top Doctors, those types of things. A lot of those are just, they're paid subscriptions. That being said, there's some regulation, but you know, it's paid for, like it's paid advertising.
Anybody could be on there.
Technically, I think you have to provide your credentialing.
Okay.
But, you know,
that's good to know.
That being said, you're kind of asking for the internet to then all your patients, hey, can you go leave me a review? Which I think really is where a lot of patients should go to get kind of more information about like how are the patients that were previously operated on treated.
Okay.
How was it on the post-operative setting? If there was a complication, which I'm just telling you, all surgery has complications. That's just the reality of surgery. But if there was a complication, how were you treated? What were the appropriate measures that were taken to like address that problem? Because I guarantee you, surgery is fraught with complications, and you know, you need to know like what's going to happen if you sadly are one of those patients that has one.
And that's going to be the main difference, is having a surgeon who knows how to handle those complications in surgery and through that healing process.
Yeah.
I mean, I don't know about y'all, but I don't want any complications happening in this area. That's kind of an important area to me. That's breathing, that's eating, that's a lot of important stuff is happening right here.
And they can.
And above here.
Yes, exactly. Right. And so, you know, again, same thing, like you just need to have those informed risks and knowing that, okay, what's the % rate of a bleed afterward? What's the % rate of a nerve injury afterward? And all of those things, again, your surgeon that you're selecting should be able to share with you, talk to you about, okay, what's the expectation? If there is one of those types of complications, again, heaven forbid, right? You think, no, I'm not going to be that 1%. But if you are, what do you do? And what are they going to do to kind of get you through that? So,
okay. So talking about complications a little bit, let's back up. Talk about leading up to a neck lift surgery. How can a patient prepare for one?
That's a great question.
Okay. Well, thank you.
Because I feel like a lot of people come in and maybe, like we're talking about like weight loss, right?
Yeah.
Like depending on where they're at, and especially with kind of the newer weight loss medications that are out there.
Yes.
Semaglutide, also known as Ozempic. There's other brand names out there, regarding it. people may be on kind of a journey where they're going to try to lose more weight. So I think first and foremost, be stable in kind of where you're going to be at. So it's not, you know, where you're going to be losing drastic amounts, but it does change the shape of your face in terms of the fat pads, fat distribution, how much skin you have, how much laxity you have. So kind of get yourself to a point where you're like, okay, I've been stable at least a year.
Okay.
That's kind of my recommendation.
So it's not necessarily wait until you hit your optimal goal weight, because let's be honest, how often does any of us really get there?
Yeah. If you're on the journey towards your optimal goal weight and you are still losing weight,
you're actively losing,
I would say wait on your surgery. If you are like, you know what, I'd love to be 50 pounds 30 pounds lighter, but I've been stable here for 5-6 years, I'm probably going to be where I'm at, and having kind of that realistic expectation with whoever's been helping you on your weight loss journey too, I think is also important. But you don't want to rush into anything too soon.
Okay.
Because what can happen is, say, again, like we talked about, like, okay, say the buccal fat is a concern, and then you lose a bunch of weight. Ozempic actually has a kind of disproportionate weight loss in the face and the neck compared to some of the other weight loss drugs that have been out there years ago. And so that's kind of an interesting conversation. Yeah. It just seems like as an aesthetic world, we are seeing, okay, like Ozempic face, you might have heard.
Right, yeah. Where you're kind of getting a little more gaunt or, you know, hollow. Yeah. It's interesting that, total tangent, but it's very interesting that different medications will target or side effect have you lose weight in different areas.
Yeah, in different areas,
Interesting. Okay, back on topic.
So that's kind of first and foremost is making sure you're kind of in a stable spot. Secondarily, there's some controversial opinions on whether or not you should be on Accutane, like if you are on Accutane, if you should hold it for how long, or if it is safe to go ahead and operate while you're taking Accutane. Okay. So that's another one. Patients may or may not be on that medication. It's typically an acne medication that's prescribed by like a dermatologist. Right. And patients are on it, you know, for usually a certain duration of time.
Right. Which as an esthetician, I'm like...
But you have to be really careful because it impairs wound healing.
Absolutely.
So the wound healing component, again, have that conversation with your surgeon. Should you hold it? How long should you be off of it for? How long do you need to be off of it afterward? Again, there's mixed literature that's coming out that says maybe you don't necessarily have to stop it for a certain amount of time, but the majority of us that are pretty conservative would say, okay, well, you don't want to take any risks on your wound healing. Similar along those lines for wound healing, no smoking, no vaping, no nicotine use, even like a nicotine gum. Okay. And I always tell people, like, we all have our vices, right? Everybody has something. And so there's no shame in necessarily like having those things.
It's not about that.
Right. Like nobody cares about that. What they care about is your wound healing. And the nicotine in the tobacco constricts the blood vessels. Okay. And what happens when you're going to heal is you need new blood vessel growth to heal that area. Right. So it's purely from that. Okay. So trying to cut back to begin with and then kind of slowly getting yourself completely off of those products is really going to give you the best results.
Now, what's the risk of not having that new blood into those areas?
So say, for instance, you're doing neck lift and you have to go under the skin. So you have to go under the skin to get down to the muscle, to get down to tighten it. But by going under the skin, you're innately thinning the skin. Okay. If you're thinning the skin from the underneath surface and the blood vessels in there are not good to begin with, you can get something called tissue necrosis. What does that mean? That means that maybe where your incision is or where the dissection was, that actually turns black and scabs over and doesn't heal. It doesn't look pink and healthy.
It looks black and
dead.
Yeah. Like charcoal.
And then you're hoping, okay, is the skin going to regenerate? Is it going to re-heal? And you're waiting again for new blood vessels to come in, and then it can get infected. So there's all sorts of scary things that can happen.
You just don't want to mess with that.
You don't want to mess with it. It's like just give yourself the optimal healing results, and again, really being without nicotine products, smoking, vaping, patches, you know, any of that kind of stuff for at least, depending on the surgery, depending on the surgeon, for like at least 3 months beforehand and at least 3 months after.
To give your body that time to get it out of your system and then time for your body to heal post-surgery.
Yeah.
Okay.
And, you know, you have to mention that a lot of neck lifts are performed under a general anesthesia or at least a MAC, like a twilight type of anesthesia. And smokers have a harder time with that as well.
Oh.
Because your lung function isn't as good. They have more gunky stuff that comes up. So it's a higher surgical risk from the anesthetic perspective too.
Okay. So typically would that then need to be done in a hospital setting because of that higher risk, or are you okay to be in a surgical center outside of the hospital?
Depending on their other risk factors. But in my opinion, if somebody's going to have elective surgery, meaning it's not for cancer, it's not for a trauma, it's not for something that acutely needs to be done right now. Again, elective surgery, neck lift, that type of thing. Yeah. Better to wait.
Okay.
Wait completely till somebody's not smoking.
Yeah.
Yeah.
That sounds good.
Other things that people can do to prepare are essentially everything else that we talked about, like keeping your skin nice and healthy, making sure that you're getting good protein in your body, making sure that you're getting nutrition to that skin. And so sunscreen, a retinol, making sure that all of your skin is like prepared to do that healing.
All that good stuff.
Yeah.
Just thinking, get back in the mojo.
Back. Hi, we took a little hiatus and where do I look? Oh, there.
There we go.
I always feel like I'm looking like
I know. I always like look in the dot. I'm like, yeah, that's the wrong spot.
Hi, how are you?
What's up?
Brie had a chemical peel, and she looks kind of like she's
I look like the crypt
keeper. Like she's been in the lava. That's the other thing. Don't get waxed. Facial waxing. Don't get burned, sunburn, that type of thing before your surgery. There's another fact.
That's a no-no.
No waxing like a week and a half to 2 weeks before.
Oh, what about nostril waxing?
Oh, that's controversial.
Oh.
Okay.
Okay.
So I do a lot of rhinoplasty in my practice, and I love rhinoplasty. Rhinoplasty is great. Love it. Anyways, but if you think about the nose, it's not technically a sterile area.
Yeah, no.
It's not like you're making a cut out here where like, hey, this gets sterilized, right? You clean it and then the skin is underneath is sterile.
Yeah.
The nose is already full of whatever your nose is going to be full of. Bacteria, stuff that lives on our skin, yeast, you name it, it's in there. And the nose hairs, you worry about if somebody regularly gets them waxed, if they get them waxed right before surgery, you worry about those bugs that live in the nose being able to crawl into that space.
Oh, ew.
So,
I just got
most people would
ickies.
say don't wax the nose, mainly because of that, before your rhinoplasty. And it's better to trim the nose hairs, not necessarily pulling the follicle out so that something can get in.
Okay.
But again, it kind of depends on the surgeon.
Gotcha. Yeah. Some want you to have it waxed, some don't.
Some would say, oh, it's nice to have it waxed for convenience because then as a surgeon, there's no hair in there.
Yeah.
But my opinion is don't even take the risk, just trim it.
Okay.
Or have your surgeon trim it during the surgery. So.
Oh, what a nice little service you provide.
Yeah.
My surgeon trimmed my nose hairs. I love that. Do you offer that along with your piercing pagoda?
Yes, exactly. Yeah. And if you have a piercing in your nose, it will close up after your rhinoplasty.
Aww.
So you have to get re-pierced, which is, depending on the surgeon, some people will redo it for you.
Okay.
Yeah.
Which Bethany actually gave me this one.
That's right.
I love it. And these. And these. It's kind of a perk to having surgeon friends.
Kind of a perk to being able to do surgery on people is also knowing where to pierce.
Knowing where to stab the needles.
Yeah.
I love it.
Yeah.
Okay, so now, like surgery day.
Yeah.
Right after surgery, what do we do?
Yeah. So, before your surgery day, I want people to be mentally prepared before they go in.
That's kind of important.
Yeah.
That's
every surgery you're having is a difference. It's going to change things.
Yeah.
You're maybe not going to have that full expectation until you go through it, but at least knowing to kind of what to anticipate.
Yes.
So before you even have surgery, you're wanting to find somebody that can give you a ride, somebody that's going to be able to stay with you if you need some help. Any of the things that you are going to need after your surgery from your surgeon, you should ask. So, do I need ice packs? Should I get a jaw bra, which is like a head wrap? Am I going to be wrapped for a certain amount of time? If so, how long? Am I going to have a post-operative appointment? Is that post-operative appointment going to be with your surgeon themselves, or is it going to be with one of their colleagues, or maybe with one of their physician assistants or like nurse practitioners, or a nursing appointment?
Okay.
Just kind of like asking those general questions is really nice to be able to know what to anticipate.
Gotcha.
How much bruising am I going to have? How long am I going to have swelling? When would you anticipate your final results being? Because it's not necessarily when the sutures come out, right?
Yeah.
There's still more healing and things that happen.
You think
later.
you kind of think back to Hollywood culture where you're in the hospital and they just unwrap you in your hospital bed and hand you the mirror and you're just ding, ah! You see yourself and just tear up because you're just seeing your final result for the first time. It's not like that at all.
I like to tell my patients, I'm like, you might look worse before you look better. I
know you
that
definitely look worse before you look better.
But the amount of swelling that you have, think about even if you go and you stub your toe.
Yeah.
Okay, then multiply that 10 times worse.
Right.
Because you get enough cells to get in there, and they're causing inflammation, you're swollen. So again, having that realistic expectation of okay, week 1 is not going to look pretty. Week 2 may not look pretty. We're really looking at final results after a neck lift, 4 to 6 months post-operatively.
Okay, that's a long time.
Yeah.
And I've interviewed quite a few people at this point who've gone through any number of surgical procedures. And I think that's the number one thing I hear is what shocked them the most is how long of a process it is.
Yeah.
And how patient they've had to be and how impatient they are.
Especially when you say, okay, I've had a couple of patients come in, they're like, I feel ready. I feel like I'm done. I'm done healing. And they might be in a month. And I'm like, I guarantee you still have time. And some people do say, I'm noticing the contour improvement already at a month. And to those people, I'm like, that's great. Again, you're still early. If you like it now, you're going to like it even more in a couple of months.
I love that.
Yeah. But the thing that is interesting about the neck is the neck comes down a little bit faster in terms of the swelling. If you have a rhinoplasty, we're talking about a year to 2 years.
Yeah.
It's so different.
It swells so much.
Yeah.
It's
depending on your body part.
Yeah. It's so true.
Yeah.
And the neck is so different because really there's just one, 2, 3 points, right? Then you remove the skin and all of a sudden it's doop, doop. So you're well, even with a significant amount of swelling, there's so much improvement.
And if you're just doing central neck, you don't remove any skin.
Yeah.
That's what's crazy. If you're looking, this is the secret. If you think, oh, I have a ton of extra skin here, chances are you need a neck lift with a facelift.
Oh.
I know. And it depends on the age, depends on your genetics. But if you're oh my gosh, I have tons of extra skin here, I have a waddle, can't they just take out the extra skin? The answer is what ends up becoming that neck extra skin comes from the face. And if we descend here, you start to see a jowl. What skin used to live here then lives here, and then it kind of gathers here.
So if you lift it here, it's going to sag even more here.
If you lift it and you tighten only here and you don't remove skin here, you will notice your jowl more.
Yeah.
And it depends on the patient, depends on if they have jowl formation that started, and it kind of depends on their expectation. If your skin is still pretty tight, but you just don't like that contour of the chin to the neck is not as snatched, that's a great neck lift patient. If it's a lot of extra skin, you're really thinking neck lift with facelift because you got to reposition all the tissue up.
Okay.
Yeah.
And that's where the conversation needs to expand outward.
Yep. And again, it should be a conversation with your consult, depending on, making a customized plan for that patient.
And that's where you as a surgeon need to understand not so much the treatment they want, but the results they want.
Yeah. Yeah.
Those are two totally different conversations sometimes.
Yes. Because if somebody says, oh, I really want a neck lift, and I said, oh, good, I'll go do a neck lift, and I don't address the fact that they have a prominent jowl, they will not be happy.
No.
And that's not the right conversation.
Absolutely.
That surgeon needs to then say, this is why I'd recommend this, this, and this for you.
Mm-hmm.
So sometimes people will have kind of a misconception where they think, oh, it's all this extra skin.
Yeah.
And it really is that all the tissue has come down.
Okay.
Yeah.
Now, after the surgery, we kind of dove into it a little bit as far as like healing time.
Yes.
But is there any additional things to know about post-surgery?
Yeah.
Okay.
No aspirin, because you don't want to have any blood thinners on board.
Makes sense.
You don't want to take any fish oil, other things that are over the counter that can thin your blood too.
Okay.
You will have some pain, some swelling, bruising. Totally normal. And then majority of people that are in this field will have you do some sort of like head wrap or a neck wrap, or we talked about like it being like a jaw bra.
Okay.
To kind of keep that area supported as you're healing.
Uh-huh.
Part of it is you want the skin to contour back around what you've done underneath. And part of it is also to prevent a blood fluid collection or a body fluid collection.
Okay. So kind of like force it to flush.
Yeah. Just
outward.
Like keep it up.
Okay.
Close what we call the dead space.
Gotcha.
Meaning you've removed a little bit of tissue in that area, and now the skin, which kind of is a more loose, what was contoured here, and now there's a space between.
Because it used to just all be like nice and attached.
Yeah.
And you've gone through and separated it.
Correct.
So now there's that open cavity a little bit.
Open cavity we call the dead space.
The dead space.
The space between by Coldplay. Thank you. Is that the name of that song?
Hashtag.
Again, how you know you might need a neck lift if you can reference that song.
Exactly.
If you're younger than that, you probably don't need a neck lift yet.
You're probably good.
Yeah.
Unless you're going for the snatched.
Yeah.
And not the anti-aging.
Yeah.
We gotta go to karaoke again.
Oh my gosh.
Side note.
Yes, that's a good time.
That was fun. This woman can break it out. Oh my gosh, I love it. Okay.
Yeah.
Oh man.
What else to expect? I like to tell patients, like, keep your head of bed elevated. Anything that's gonna increase your swelling, aka like aerial yoga,
don't do that.
It's not the time to take it up.
When could you start doing
Probably
activities like that again?
4 to 6 weeks.
Okay.
Depending on how you're healing.
A nice long wait.
Yeah.
Okay.
First week, we still want you to get up, walk around, get blood flowing. We don't want you to, stay stagnant and be bedridden.
Blood clots.
Blood clots, right. We
Bad
want to prevent
news.
that.
Mm-hmm.
So still getting up, walk around the block, do kind of your normal activities around the house, but don't do anything super strenuous.
Okay.
Because you don't want to pop a blood vessel open.
That would be bad.
Week 2, slowly you can ramp back up to doing kind of more increased types of activities, but maybe you're not doing like a high intensity workout.
Okay.
Week 3, you can start easing back into that.
Mm-hmm.
You might notice throbbing in this
Little
area.
Low intensity workouts.
Yeah.
A walk around the neighborhood.
Walk around the neighborhood for the first 2 weeks.
Uh-huh.
3rd week, if you're really into, again, like a HIIT class, try it. Listen to your body. Make sure that you're backing off if you feel like it's too much.
Gotcha. Maybe not the full hour.
Maybe not the full hour. Maybe like a 10. Maybe a 20. Yeah.
Increase it.
Yeah. And then...
Ooh, what about swimming?
Yeah, people always ask about this.
Okay.
So I say wait 6 weeks. You're not watertight in that area, even though it looks like it might be healing well, until about that time. So you're not going to be like snorkeling or scuba diving or surfing or anything like that where you're really getting quite a bit of water exposure for at least 6 weeks.
Okay.
And sometimes more depending on how you're healing.
Gotcha.
Yeah.
You said watertight. I'm thinking like ship ready.
Yeah. I have a horror story.
Oh, let's hear it.
I did have a patient that did, for lack of who knows why, did not listen after a particular surgery.
Oh no.
And said, yeah,
I'm good.
And went to a public pool.
Problem one.
Went swimming at 1 week post-operative.
Oh, no way.
And I thought, oh no. And I hear about this later because this person came back in with a bad infection.
Oh.
And it was growing different types of bugs than you would expect. And then I thought, yep, that's what lives in the public pool. So just listen to your surgeon.
Yeah.
Listen to their recommendations with those types of things, especially around dirty bodies of water.
Just don't do it. Don't do it.
Yeah, the patient did fine, just FYI. Just
Okay,
to
good.
you know.
Whew.
Did fine. We
I'm
had to
thinking,
treat with antibiotics, had to drain the infection, you know, quite a bit of maintenance afterward to make sure that we were getting them back on track. But, you know, we were here for it. It's something that we got through. But
That's good, but it's a headache that the patient didn't need to add on.
Right. They didn't necessarily need to have that infection.
So following surgeons' recommendations, they're not recommendations like, oh, it's not required. It's
all
do
for
this.
Safety.
Yes.
Yeah,
There's
all
reasons.
Yeah.
Okay.
Yeah.
Perfect. Like the more you follow it, the better the results you're going to have.
Yes.
There's reasons for each of them.
Yeah. Don't go swim 1 week after your surgery.
Please don't. Just let your body heal.
Just let it heal. Just let it be.
Speaking of, I think that's probably the next thing that patients have told me is really surprising to them is how tired and fatigued they feel afterwards. And part of that, I think the first couple days, a big part is the anesthesia wearing off. But then I think people don't realize how much energy it takes away from your body to heal from a surgery.
Yeah.
Especially like, you know, the face is a little bit smaller areas, but that still takes a lot of energy. But when you're doing like, you know, a tummy tuck or something bigger, it really requires so much of your body's resources going to that.
Yeah, that's so true. You know, think about even if you get a cold.
Yeah.
And your body's like trying to heal that, trying to put cells in that area to kind of fight that infection and get upper respiratory infection, right? It's just like you're drained.
Oh, yeah.
And not necessarily exactly the same, but similarly, your body has to mount an immune response. It has to say, hey, something happened here, an injury happened.
We were traumatized.
We were traumatized, but like for the name of beauty.
Yes.
And so
worth it.
They're trying to heal. You know, all those cells are putting that inflammation into that area, trying to heal. And it's a resource that's being taken from the rest of your body.
And literally trying to like create new like skin, which is that scar, to bring it back together and to like close that dead space.
Yes, exactly.
Codeplay.
Yeah.
Oh my goodness. Okay. Any other information about neck lift that we could put out there?
Again, listen to your surgeon, ask the right questions.
If someone doesn't know what the right question to ask is, how can they figure out what to ask?
Ask your surgeon that you're going to see their before and afters.
Okay.
I think that's a really nice conversation starter, and that might prompt you to have a question.
Okay.
And you can say, okay, you're showing me this before and after. How long after is this? And that kind of segues into how long is the healing time?
Okay.
How long would I expect to be bruised or swollen? If you have an event coming up, you know, ask those types of questions too. Like, hey, I have a wedding in 6 weeks. Is that going to be enough time? I have a wedding in 1 week. Is that going to be enough time?
No.
But, you know, plan it around your life. I think that's what is kind of neat about the field that I'm in, is that a lot of it is elective surgery. It's quality of life type of issues that we're dealing with, which are obviously like very impactful. You know, it's really cool to be able to kind of like get on board with that patient's journey, whatever it might be. And we're like, like we're your cheerleader, you know?
I love that.
But at the same time, that's the nice thing for that patient, is that it's elective surgery.
Yeah.
You know, at the end of the day, you can elect when to have it, when to not have it, or never to have it at all, right?
Yeah.
And so having that conversation, making sure that you're informed, making sure that you know and you have realistic expectations with your surgeon that you're consulting with is kind of the main thing that I would recommend.
I love that. All right, Dr. Powers, where can people find you?
I am on Instagram. My name is Dr. Bethany Powers, Bethany, Powers, like Austin Powers, but not.
Yes.
So Dr. Bethany Powers. Also, I'm currently at the Ward Institute, and so you can find me if you Google Ward Institute, Dr. Bethany Powers. You can find me on the internet.
You come right up.
So,
Love it. Awesome. Thank you so much.
Yeah, thanks so much.